Potential heterogeneity between angiotensin II receptor blockers and their anti-aortic root remodeling properties in Marfan syndrome. Our lab has previously shown that losartan does not inhibit aortic root widening in Marfan syndrome mice through ATR1 and blood pressure dependent pathways, but instead through increased production of nitric oxide, a potent vasodilator and key protective regulator of vascular homeostasis and overall endothelial function. This led us to ask about other ARBs' potential in activating NO and possible heterogeneity that may exist between this class of medications. In order to understand which ARB is best at increasing nitric oxide, mice were treated with different ARBs at equivalent blood pressure lowering doses. The aorta of these mice was then subjected to increasing concentrations of the vasoconstrictor phenylephrine to assess vessel function. The aorta of mice treated with telmisartan showed the greatest inhibition of contractility compared to all other ARBs and was fully rescued following nitric oxide blockade with LNA. This suggests that telmisartan is a potent activator of nitric oxide, further confirmed by telmisartan's loss of effect on inhibition of aortic contractility in mice lacking the eNOS gene responsible for NO production. With telmisartan as the most potent activator of nitric oxide, we treated Marfan mice for 18 weeks with telmisartan at a higher blood pressure lowering dose. Telmisartan treatment was able to fully attenuate aortic root widening in Marfan mice as assessed by echocardiography and resulted in significantly lower blood pressure. It also prevented classical markers of Marfan aortic pathology, preventing increased aortic wall thickness and increased elastic fiber fragmentation in the aorta. Following co-treatment of telmisartan and the NO blocker LNAME, telmisartan was unable to prevent aortic root widening, despite the co-treatment resulting in an equally significant blood pressure lowering. Co-treatment resulted in increased aortic wall thickness and increased elastic fiber fragmentation. We also showed that Marfan aortas treated with telmisartan demonstrate lower aortic contractility, which is fully rescued following treatment with LNAME, confirming enhanced NO bioavailability in the Marfan aortas. In conclusion, telmisartan attenuates aortic root widening through enhanced endothelial function and not blood pressure lowering, and it may prove to be superior to losartan in Marfan patients.